Good morning, sir. I am Nana Marie Oronan from Group 5, and my members are Ursal Vangeline, Ortega Maricris, and Cindy Rambuyo. So, our group chose beauty care NC2 because it is useful and demand skill in our community. So we choose this because many Filipino need beauty care service like manicure, pedicure, facial, and hand spa and body care. So this course help learners gain practical skills that they can use for work or small business. So it also teaches good skill like communication, professionalism, and customer service. So we choose this because many Filipino in our community needs a job and extra income. So it is also very helpful for women because they can learn skills that they can use to earn money. So they can work in salons or even start their own small beauty business at home. So we also choose TESDA because it is trusted government agency, so that gives proper training. So TESDA makes sure learners are trained well and ready for a real job. It also give certificates that help people find work easily. So we also decided to place our training location in Nabwa because it is our own community, and it is more accessible for the Filipino in here. So it is easier for learners in our area to attend training without spending too much for transportation. So we also chose Nabua because many potential trainees here, especially women, want to learn beauty care skills for livelihood by placing it here. So we can help our community to grow and provide more opportunities for local employment. So overall, we choose beauty care NC2 in located Nabua because it is useful again and practical and helpful for our community, so especially for a woman. So in competency map, beauty care NC2, in basic competency, participate in workplace communication. Second, work in team environment. Third is practice career professionalism. And fourth is practice occupational health and safety procedures. So common competencies, maintain an effective relationship with clients or customers. So manage own performance. Third is apply quality standard. Fourth is maintain a safe and clean and efficiency environment. So core competency, perform pre and post beauty care services, perform manicure and pedicure, perform hand spa, and perform body massage. So perform body scrub, perform facial treatment, and perform foot spa. So the last one is perform facial makeup. So today we will present our competency-based curriculum or CBC for beauty care NC2 based on TESDA training regulation. As we discuss our CBC documents, so we will explain why we selected our learning outcomes, methodology, and assessment methods, and how these are aligned with competency-based training principles. So the first question is, why the learning outcomes were selected? So for the learning outcomes, we selected them directly from the training regulation because there are the required competency for beauty care NC2. We include competencies such as workplace communication, teamwork professionalism, and occupational health and safety. And beauty care services because these are the actual skills needed in salon and beauty care establishment. So we choose these learning outcomes because beauticians beauticians do not only need technical skills, but the proper also need the communication, teamwork, and professional attitude. So when dealing with clients, professional attitudes when dealing the clients, for example po is the learning outcomes, prepare tools and equipment. It is important because beauticians must know how to prepare and sanitize tools properly before performing services. Another example is the maintain effective relationship with clients. So, which helps trainees develop good customers service and good communication skills. So by selecting these learning outcomes, we ensure that trainees before competent, responsible, and industry ready workers. Second question, why we choose training methodologies are appropriate. So, for the training methodology, we selected group discussion, demonstration, simulation, role-playing, interaction, and practical activities. These methodologies are appropriate because beauty care in situ is a skill-based qualification, which means trainees learn better through actual practice and preparation rather than pure lecture only. So we use demonstration because trainee first need to observe and correct procedure before performing task themselves. For example, before doing facial treatment or hand spa. So the trainer demonstrate the proper step, safety procedure, and correct handling tools and materials. So, role-playing and simulation are also important because they allow trainees to experience real salon situation. Through this activity, trainee practice how to communicate with client, respond to concern, so and provide the proper customer service. Group discussion and interaction help trainees improve communication and teamwork skills. Since salon usually involves coordination with co-workers and dealing with clients. So these methodologies prepare trainees for real work situation. Overall, the methodologies were selected because they support active learning, hands-on experience, and mastery of skills which are important in competency-based training. The third question is, why the selected assessment methods are suitable? For the assessment method, we selected written examination, demonstration, practical or personal test, interviews, and observation. So these assessment methods are suitable because they evaluate both knowledge and actual skills for the trainees. Written examination are important because they assess the trainees' understanding of concepts. So workplace procedure, safety practices, and beauty care principles. So for example, trainees must understand proper sanitation, occupational safety, and correct procedure before performing actual service. So practical or performance tests are very important because beauty care in situ focuses on skills performance through the assessments, trainees, demonstration. So the correct procedures in manicure, facial treatment, hand spa, body scrub, and other services. Observation is only appropriate because the Trainer can monitor if trainees are following the correct procedures, using proper hygiene practices, and applying safety measure during the activities. So, in interviews are included as to assess communication skills, confidence, and understanding of workplace situation. Since beauticians interact directly with clients, community skills are also important to assess. These assessment methods are aligned with competency-based assessment because trainees are evaluated on their actual performance and ability to meet industry standard. Fourth question is, how the CBC is aligned with the PR and CBT principles? So, lastly, our competency-based curriculum is aligned with the TESDA training regulation and the principle of competency-based training or CBT. So, the curriculum follow the competency stated in the beauty care in situ training regulation, the learning outcomes, training contents, methodologies, and assessment methods were also based on the required standard under TESDA. Our CBC is also learner-centered because trainees actively participate in demonstration, simulation, and role-playing.